So, welcome everyone. This is session 5 of Family Voices of Minnesota's Family Leadership Institute. Today we're going to be covering parents, professional partnerships, and family engagement. We have a couple of objectives today. We're hoping to help you understand and identify the key characteristics of authentic parent-professional partnerships, and also help you advocate for and employ strategies for authentic parent-professional partnerships within your individual roles, excuse me, as family leaders. If you wouldn't mind, please leave your phone on mute today unless you have questions. When you have questions, please feel free to unmute and ask, or you can use the chat box and I will read your question to the group. Today we have with us Carolyn Allshouse, who is the Executive Director of Family Voices of Minnesota. She has extensive experience in serving in the role of being the parent in the parent-professional partnerships, and also has helped develop several tools to really guide family leaders in this area. Today she is going to be presenting to us on families as essential allies. And so welcome, Carolyn. Thank you so much for taking your time to do this with our group today.
Hi, everybody. I'm happy to have the opportunity to be with you today. I'm going to share my screen so that everybody can see my PowerPoint for today, and then we'll get started. So I'm hoping that everyone had an opportunity, if you weren't able to be on the call last month with Bill Schwab, that you had the opportunity to listen to the recording. This webinar really sort of builds, I think, on what we heard last month from Bill around family-centered care. I'm going to be talking about some specific tools that I think you'll be able to use if you're serving on a committee, a task force, a work group. But in addition to these types of opportunities, these tools will also be useful to you when you're working with providers or teachers or other support staff when it comes to the care and the support of your own individual child. So that's what we're hoping will come out of this presentation today. So first of all, this slide might be familiar to you. Bill talked a little bit about this last month in his presentation about family-centered care, but I think it's useful to revisit this idea because I'm going to really challenge you to think about how you view your role when you are working on a committee or a work group or working with providers on the care of your individual child. Sometimes we find ourselves in a position where we might feel adversarial in these relationships. And that happens because sometimes we don't agree with what's going on, or there may be differences of opinion about a course of treatment or how particular services are being provided. And that can create sort of that adversarial feeling that we as families may have when we're trying to work through these issues that we may be experiencing. Sometimes we might feel like we're also maybe being treated like we're the patient instead of the focus being on our child as the patient or the individual who is receiving the services. And that's not always because providers or other professionals are trying to be condescending to us, but it may be in a very well-intentioned way, that they're sort of taking all that caring that they're showing or feeling that they need to show to your child, and they're turning that to you as the parent. But what they don't realize is that that can be a very paternalistic approach and actually can undermine the parent's ability to fully participate in decision making, because we may not be viewed as knowledgeable enough. And that might not be the intent, but that may be how we feel about how those kinds of encounters occur. I am frequently struck when I'm in conversations with especially medical providers or on committees in the healthcare arena, where they'll actually use the terminology, well, your doctor. And it's not my doctor, it's my child's doctor. The doctor is not my doctor. The doctor is my child's doctor. And that's a very important differentiation to make, both in how we view our role, but in how they view our role as well. So the next idea is the idea of partner. Now, this is a very popular term that's used all over now. It's written about, it's talked about. The whole idea of parent-professional partnership, it just rolls off the tongue. It's very rhythmic, and it's a very typically used term. But when I think about that word partner and partnerships, I often think that usually partnerships are contractual. They often need to be defined, and it doesn't necessarily mean that it's an equal partnership. So I think about what is the level of equality when we're talking about partnership. The next word is colleague, and that's a really interesting word. So, you know, what does colleague mean to you? I'd be interested, and I know, Dawn, you're driving, but I'd be interested to know from all of you, what does the term colleague mean to you when you hear that word? Anybody have any thoughts about it?
This is Trisha, and go ahead, Dawn. Go ahead.
Okay, so this is Dawn. I think of colleagues depending upon the situation that I'm in. When I'm in a group of families, they're my colleagues, especially families who have kids with disabilities. And then, if I'm at work, then my colleagues are my co-teachers, my co-workers.
Mm-hmm. Great. And Trisha, what were you going to say?
I was just going to say, historically, when someone says colleague, I think coworker. It's always very job related. I've been able to open my mind, expand my definition, kind of like what Dawn said, depending on what group I'm in. But historically, it's always meant coworker in a place of work to me.
So if I could share with you what I think about that word, usually when we think about colleagues, it's often that we're coming together with varying experiences and different expertise. And yet, when I think of the word colleague, even though we have that different experience or different expertise, that we come together as colleagues equally, and that expertise and experience has equal value among colleagues. So I would like us to maybe give some thought to the idea of thinking about ourselves as colleagues working together with the other professionals that we work with on committees or work groups, or even in the care of our individual child. We all are coming together to be part of a team, and we all bring different experience and expertise that I believe all has equal value. So the last word is employer. And this is something that some advocates think about when they think about their relationships with various other professionals or providers. I'm paying for this service. My insurance is paying for this service. My tax dollars are paying for this service. You're my employee. You should think of yourself as my employee working on behalf of my family and my child. That's one way to think about it. But in thinking about it in that way, it may not create an atmosphere of collaboration. And so what I'm going to be talking about as we go along today is the idea of when we want to have an opportunity to influence and be part of committees and work groups or the care of our child, that we may want to give some really important thought to the idea of collaboration. So this is an idea about collaboration that's defined as meaning that no one interest group is always right. It means that we take what you think and what I think and what someone else thinks, and we come up with something that works for everyone. So this quote is from a book that was published many, many years ago called Essential Allies, Families as Advisors. So the idea of collaborating can be a challenging concept to think about, because that idea of blending ideas that work for everyone might be a really great way to collaborate, but it is also challenging when we come to an interaction where we think our idea is the right idea or our idea is the best idea. So it can be challenging to think that we may have to blend ideas together in order to work effectively with whatever team or group we're working with. But I think it's going to be really helpful as we think about how do we collaborate, to think about what our goals are in that collaboration, and more broadly, what are our goals for the committee or the work group or the care of our child? What are our goals for those interactions? So I have been involved in doing this work since the late 1980s and have had the opportunity to work with lots and lots and lots of different families and lots of different professionals in the healthcare arena, in the human services, in the education arena, and my own personal experience being a parent. I think one of the things that we need to all recognize is that this journey that we are on as parents is one of discovery and knowledge, and that it's a pendulum. We often go from one extreme to another extreme. And we start off when we enter into these systems at the very beginning, knowing very little about the systems and about advocacy for our children. We often are in the position of needing to follow the advice that's given to us by whatever providers and professionals we're working with. And we follow that advice until we maybe encounter a problem. And it may be a system problem, it may be differing opinions between providers or professionals. There may be varying reasons that we run into problems in this journey. And then we start to build our courage to be our child's advocate. And we start to learn about the fact that we really know a lot about our children, and that maybe that knowledge isn't being utilized as we're making decisions about services or care. And we learn that we have to be an advocate for our child in order to get the services that our children need, that our family needs. And we build that courage, and we start seeking out the opportunities like this to be able to learn more about how to be an advocate and how to make improvements in the system. And a lot of times it's not uncommon, and it's not wrong. I'm not going to indicate that this is wrong, but we may go to a very far extreme with that advocacy for our children. And it may be based on very good reasons that we're saying we are doing it my way or no way. It is absolutely, there is no compromise. I am right and you are wrong. And I can't bear to see another failure or another problem or another health crisis because somebody didn't make a good decision. So we take that advocacy to the far extreme. And a lot of times that's what parents need to do. They need to do that in order to then maybe come back to a little bit more middle ground to start thinking about, well, what do other families experience? And how we need these relationships with our children. And if I'm too far of an extreme advocate, I'm not building relationships. I'm not building collaboration. And I need these people. I need the specialty providers or professionals in my child's life. I can't be the doctor. I can't be the teacher. We have to be able to somehow reach some compromise. But how do we look at making changes to the system so that it's not so hard? How do I learn what other families experience and have a broader understanding beyond just my own experience? It's when we have that opportunity to understand what other families are going through and what other families are experiencing that we start to get a broader understanding of the systems and what is happening in the systems. And that's when we're able to look beyond our own situation, that we are really then in a position that we can really start to collaborate to make system improvements. And that collaboration hopefully includes working with other professionals, with providers on teams and committees to help make system change and do it in a way that's collaborative and working together with all of these other people. That same thing holds true as we're thinking about how we collaborate and yet can still make changes when we're looking at the care of our individual child, and how do we use our experience and expertise to make those changes. But we have to be able to come back to sort of a central place and not be too far on the extreme of the pendulum one way or the other in order to be effective. So one of the things that I know, because I've observed it and have seen it in my life with my child, is that systems are continually learning and changing. And oftentimes that learning and changing happens as a result, and has in the past happened, as a result of the work that families have done to work on system improvement. So as just an example, when my son was first discharged from the intensive care unit as a baby in 1987, at that time, the healthcare providers got together and had a discharge planning meeting, and parents were not invited to participate in that discharge planning conference. They put together a plan and they brought it to my family, and said, here's your discharge plan. In addition, at that time, in the intensive care unit, families were guests, and there were visiting hours for families. Families could only be in the intensive care unit at certain times. And when they were rounding in the intensive care unit, the families had to leave the unit because they were afraid of one family overhearing the experience or the situation of the family next door to them. None of those things exist today. I should say that generally, and in children's hospitals, none of those issues are still the same today. Families generally don't have visiting hours. Families are part of the team. So I've seen a lot of changes over the many years. But how do we use our knowledge and experience to improve the system and also be collaborative? And really, communication is the key. So we're going to talk a little bit about communication. I think you all know this. I think we've talked about this in previous presentations. Families who have children or youth with special needs or disabilities have a really unique perspective that providers and policymakers and other professionals don't have. We have the perspective of being someone very, very close to the system, but not constrained by the traditions and the cultures of the system. So we have the opportunity to be creative about what changes are going to be beneficial or how the system really works. So sometimes what happens and can be a barrier to families being able to participate on system improvement committees or work groups is that professionals are very worried about showing their problems or admitting that there are problems in their systems. The reality is that families already know how the systems work. They don't necessarily know how it was designed to work, but they know how it really works. And families already know the system flaws and failures because they live it every single day. So it's one of the things that we have to help the professionals and providers and policymakers to understand, that we have this very unique perspective on the system that they really need and that they don't have. And one example of that I would like to just share is the fact that a number of years ago, I coordinated a medical home quality improvement learning collaborative at the Minnesota Department of Health. And we brought together teams from pediatric clinics around the state. And the teams were required to have a pediatrician or primary care provider, a nurse who could serve in the role of a care coordinator, and at least 2 parents from that clinic who were going to be part of their quality improvement team. So we had this one really great team who was very enthusiastic about being part of this learning collaborative. And the doctor and the nurse, the 2 of them got together and they sat down and they made a list of all the really important improvements they thought that their clinic needed to make. Then they brought in their 2 parent partners and sat down with them and said, well, here's this list of improvements that we think the clinic needs to make. And one of the parents said, well, this looks like a really good list, but I'd really like it if there was an accessible door so it's easier for me to get my child in the clinic, my child in a wheelchair, get into the clinic. And the doctor and the nurse said, oh my gosh, this is a brand new building. We have accessible doors to get into the building. And the parents said, well, yes, to get into the building, but not to get into the pediatric clinic specifically. They didn't have an automatic door. And so it was really hard for her to get her child into the pediatric clinic while her child was in the wheelchair. Well, the nurse and the doctor never used that door. They had no idea that there was this issue. And it was the first aha moment for this team, understanding why they needed parents to be at the table and what they as providers had no idea about. So it's just an example of the important perspective that parents bring to all of this work. So families are resources to tell providers if improvements are working before something is fully implemented, before a change is made. We got to test it out and see if this change is going to work. Parents can be suggestive, suggest creative ideas for improvement. They can really help professionals understand other systems and other resources. All of these different systems and the professionals within those systems are very siloed, and they often don't have a knowledge and understanding of the other systems. And so we can help them understand those systems and what resources might be available in those other systems. Families also have professional lives and can bring unique expertise from their professional life to a committee or to a team. And we sometimes forget about that our perspective as a parent is important, but we may be able to help the team in other ways. So for example, a parent who has a lot of expertise in information technology may really be useful to a team and offer some really useful suggestions about some different and unique IT improvements that could be made. One of the other pieces is if we can work collaboratively, families are really in a position where they can be energizing drivers for a team. We can encourage those professional team members that this is important work, that it's needed, how important it is, what it's going to mean to other families, how making these changes and doing this work really is going to make a big difference. And let's not give up. Let's not get discouraged. Let's keep remembering that we're doing this to make the system better for kids and families. That's an important role that we can play as families if we approach our role in this work in a really constructive and positive way. There are certain elements of collaboration that are really important and tie back to what I just said about the important role we have. In order to be collaborative, we have to have mutual respect for skills and knowledge. We have to come to that team knowing we bring skills and knowledge, but so do the other members of the team, whether they're other parents, whether they're other professionals, whatever role they have, they're bringing skills and knowledge to the team. We have to have honest and clear communication. And we have to be willing to have that honest and clear communication, and I'm going to be talking about that more. We also have to have understanding and empathy. The understanding and empathy that we would have for another parent, we need to be able to have that same empathy and understanding to the providers and professionals that we work with. We have to remember that some days are bad days for everybody. We aren't always perfect, and we need to have empathy for that. We also have to remember that we don't know what other people are going through in their lives, and we really don't. It's important to have mutually agreed upon goals. That's an important part of collaboration. So when we're part of a committee or a team, we really need to know that there are mutually agreed upon goals for the purpose and what we're going to work on in this group. We need to have shared planning and decision making. So that means we have these agreed upon goals, and then we're going to work together in a very specific shared way for how we plan and how we make decisions as a team, as a committee. We need to be able to have open and two-way sharing of information. that is sometimes a challenge because sometimes professionals come into these committees or work groups or team with certain kinds of system information that families may not have. And those professionals need to share information with the families who are on the team in a way that's going to be helpful and important in order for us to work together in that shared planning and decision-making role. There needs to be accessibility and responsiveness. So that's among everybody in the team. Everybody needs to be able to access each other on the team, and everybody needs to respond to the needs or the questions that anyone on the team might have. We need to have a joint evaluation process. That should say, it says progress, but progress too. We need to have a way of everybody evaluating how we're doing on the team. Are we meeting our goals? Are we working together and doing that shared planning and decision making? And then, of course, always there needs to be an absence of labeling and blaming. And that, again, is a two-way street. We can't go into a committee with a group of other individuals and have a chip on our shoulder and be blaming everybody else in the system because the system failed us or because things didn't go well for our family or doesn't go well for all the families we know. We have to be able to go in with the understanding that we're going to work together to solve these problems. On the reverse side, of course, we also don't want providers and professionals to be labeling and blaming families for the problems in the system, which I think we most frequently hear. And we know that we're often blamed and labeled, and we can address that if it comes up, but we have to also make sure that we're not in the position of doing the same thing. There are barriers to collaboration. One is attitudes and perceptions about each other. I think I just sort of talked a little bit about that. That happens a lot. Past experiences can be a barrier, again, from both the family perspective and the professional perspective. We may have been on previous committees that were a waste of time, and we may be entering into this new committee with the expectation that it may be a waste of our time, and we may go into it with a bad attitude. There may be cultural differences that may present barriers, and that's not uncommon. And those cultural differences may be institutional cultural differences as well as the more traditional ones that we think about. There may be socioeconomic and educational influences that can be a barrier, and it can also relate back to the attitudes and perceptions that others may have who are part of that committee. There may be a lack of skills on the part of anyone and everyone on the committee, things like not knowing how to run a meeting effectively. That can be a huge barrier and is often the reason that committees and work groups are not successful, because there are not good facilitators, and there also, the next thing might be the lack of logistical and administrative support for a specific committee or team or work group. That can be a significant barrier and can really influence whether or not a committee is able to be successful. One additional thing to think about is different purposes or agendas that people might be bringing to that committee or to that team. That can really be a barrier. And that's why, going back to the previous idea of really making sure that we have a good understanding of what the goals are of that team. So I really encourage parents to think about, and again, this is true at every level, whether you're on a committee, a work group, or in the care of your individual child, you have a responsibility for your own good communication, and also you can be a role model for other people, whether it's that healthcare team or those providers and professionals that you're serving on a committee with. So be thinking about what are the goals of good communication. Hopefully it's around positive, respectful, and trusting relationships. Because when it comes down to it, this is really a lot about relationships. And it's about building those positive, respectful relationships. So one of the things that we need to be able to do is to express our needs and our opinions clearly and directly, but in a very kind way. We don't have to express our needs and opinions in a angry way, but in a clear way. And it's okay to say, you know, this is how I view this situation, and this has been my experience and the experience that I've heard from other families. We don't have to shy away from maybe talking about negative experiences. We can talk about them, but we can also make suggestions. We can talk about the negative experience and then talk about what would have been more effective, what would have been more helpful, what would have made a difference in how that encounter went or how that system worked. We have a responsibility to be well informed, to be calm, to be prepared, and to be persistent. So as we're thinking about collaboration and taking that idea of taking different people's ideas and coming up with something we can all agree on, that doesn't mean that we can't be persistent about what we think or what our experience is. But we also need to make sure that we're really prepared, that we really know the topic, that we've done some research before the meeting, that we've talked to other families and gotten their input or perspective, or that we're asking the committee to provide information about what other parents have talked about to them. We need to stick to one issue at a time. So when we're on a committee or a team, or we're working on the care of our individual child, it's not very helpful if we start off on one issue and we go on a tangent down a road where we're bringing in 12 other issues that we've experienced, because we become very passionate about this work and wanting to make sure that we get all of our ideas out on the table. It can get really confusing, it can get really chaotic, and it doesn't make for very good communication. So it's important to help make sure that in our own minds that we're sticking to one issue at a time. And if other issues come up in our minds, that we write them down, that we make sure we keep track of them. We don't want to lose sight of those issues. But maybe we can also suggest that, like in a committee, for example, that we could have a parking lot where we can put other ideas and bring them up at a different time. This is a really important one. We need to ask for clarification when we don't understand, and it is so hard to do that. It is the most difficult thing when you're in a committee or you're on a work group and people are using jargon or using words that we don't understand. It is very intimidating to say, you know, I'm really sorry, I don't understand what you just said. I don't understand that word. I don't understand this alphabet soup. It's very hard because we as parents feel like, oh, maybe we should know that. What did we miss? We tend to feel stupid when we say, I'm sorry, I need more information. But there are some ways that we can ask those questions by using words like clarification, Could you explain it differently? And I am going to talk a little bit about that in just a moment. But please remember that it's important to ask for clarification when you don't understand. I've talked about this a little bit already, but attitude is everything. We can't control the attitudes of the other people coming into a committee working with us on a team, but we can control our attitude. And it is going to make a difference in terms of how well that team functions and how we're viewed on that team. So I would encourage everybody to really think about your own attitude when you're going into these situations, really consciously. What am I thinking about this? How do I feel about this? Do I need to make some changes in my attitude? So think about that in a very conscious way. Seek first to understand. That's a very basic concept, and we hear it a lot. But when we're not sure if we're understanding something, we need to be thinking about how well are we listening to the other person. Is the other person having a difficult time explaining their perspective? Or is it that we're having difficulty understanding? But it's very simple to say, you know, I'd like to clarify what I'm hearing. This is what I understood you to say. Repeat back what you heard, and then say, is that right? Is that correct? Did I understand that correctly? It gives that person the opportunity to reframe their statements or their comments in a way that's easier to understand. It also is a very sort of gentle way to let that other person know that you're not understanding. Sometimes reframing a statement is really helpful for the whole team. So asking for that repetition of the statement can really be helpful for the whole team. It may be helpful to ask for examples. So you may, for further clarification, you may say, can you give me a couple of examples about what you mean? And that's, again, another way to allow that person to better explain their position or their perspective or what they're trying to explain. So these are some tools that you can use to get that clarification that you need and to make sure that you're understanding the perspective of the other person. And again, don't feel bad if you need to ask for that clarification. Chances are other people on the committee also need clarification but are intimidated to ask or may not have the skills that you may have to ask these questions in these ways. So you can respectfully disagree, and that's okay too. You can disagree without being disagreeable or angry, and I would encourage you not to disagree when you're angry, although there are times when it's really hard not to get angry. And then if you are feeling that you're angry, you need to step back and wait. You need to wait and give yourself a little bit of time to not be angry in order to disagree. And it may even be that you can't do that at that meeting. It may be that you have to wait for the next meeting to say, you know, I'd like to talk again about this particular issue because I disagree with what we discussed, and I'd like to see if we can have some more discussion about it. So being able to have more discussion about an area of disagreement is a really good way to sort of talk through and get different ideas and try to reach a collaboration again. When you have those disagreements, you should express your own feelings without blaming others, using those I messages rather than you messages. So saying, you know, I really don't think I agree with this situation or this position. Let's talk about it a little bit more. Could you tell me more about why you feel that way? Or what your experience is that causes you to feel that way. But really keeping in mind that when we start blaming other people, they're going to become defensive. And then defensiveness starts to build those barriers. And that breaks down this ability to communicate and collaborate effectively with each other. We also need to be thinking about where we might compromise on things. So if there's a disagreement and we have the opportunity to think about how might we compromise, we should be thinking about that. And I think about that a lot of times when we're thinking about the care of our individual child, and we're thinking about, you know, the physician is recommending this treatment, and I really don't want to do that. It's too aggressive. It's too invasive. It's not where I want to start. I want to start on the other end of the spectrum. Where can we compromise? What can we do? And then how do we reach that compromise? So one way is by very plainly saying to the provider, you know, could we talk about a compromise or a stepped approach to get to where we want to go here? Can we try some less aggressive treatment or some less invasive treatment first and see how we do? Can we set a timeline for those trials of doing different things before we get to a surgery or a major intervention? So it's helpful to think in advance about where we might want to compromise, especially when we know that we're entering into something that may be causing disagreement. So one of the things that, and I just threw this up here because it's really, I think it's very interesting and I like research, but so researchers from Johns Hopkins University and Northeastern University have shown that how a doctor asks questions and how they respond to a patient's emotions are both key to what they term patient activation and engagement. However, they furthermore noted that on average, physicians interrupt patients within 18 seconds of when they begin to tell their story. So let's not be like them. Let's make sure we're not interrupting, but that we're in fact using our active listening skills. And when we're using our active listening skills, we're going to build trust and establish rapport. We can demonstrate concern. We can ask some specific questions, and then use verbal affirmations like, oh, I see, yes, I understand. And it really helps to convey to people that you understand what they're saying and that you're listening. And that's a great way to build trust and rapport. And we actually talk about that in our volunteer support parent training. We talk about active listening skills and how to really utilize those. Those same concepts are really important when we're involved in committees. You know, sometimes we're on a committee and there's so many people and there's so much conversation that we didn't have the opportunity to really share our thoughts. That's where a good facilitator should really come in. There, as I said before, there's a lot of times when there isn't a good facilitator. But a good facilitator should make sure that no one monopolizes the conversation and that everyone has a chance to speak. If you have an opportunity to be a good facilitator, this is something that'll be really important for you to keep in mind. But if you're in a committee where that doesn't happen, after the meeting, go to the facilitator or the person who's leading the meeting and mention to them, you know, there were some things that I wasn't able to say because there was so much conversation. I wonder if we, for our next meeting, could set up a signal for when you want to speak, such as a really common one that I've seen used really effectively is where when at a committee you've got name cards and you turn your name card up on its upper edge. That's an indication that you've got something to say. And it's a really easy way to do it because you're not then you interrupting and saying, well, wait a minute, or raising your hand. Instead, you're able to signal, I have something I want to say, and that allows the facilitator or the moderator to be able to call on you. But you can make those suggestions to facilitators, let's have a signal so that in future meetings we don't have this problem. But make sure you keep in mind the fact that you have the opportunity to model good collaboration by not interrupting when others are speaking. And also, what I didn't include in here, but is equally true, not having side conversations. And that's a little, sometimes that can be a challenge because certain topics bring up certain feelings and you end up talking to your neighbor about it. That's really disrespectful because you're not listening when the other person is talking. So again, when we're thinking about communication, we can start with our own experience. We can share our thoughts and information about our experiences in a way that others can learn from it, which is, and so often we have negative experiences. And rather than just throw out that negative experience, if we can back it up with, it would have been more helpful if this happened or that happened, or, you know, this would have been, if we had done this, it would have been more helpful to me. Strive to be positive, but don't shy away from those negative experiences. Your story is really important and it can help drive change. But it's also important to be brief and make sure that the story you're telling has to do with the topic that's being discussed. And sometimes, again, we can sort of get on a tangent and go down the road of bringing up every bad thing that's ever happened to us over the last 25 years. And there are times when I just want to do that, but that's not going to be helpful when I'm serving on a committee or I'm part of a team. I need to stay on the topic at hand and then hope that maybe at another meeting I'll be able to talk about another really awful experience that I'd like to be able to have us work on. One of the things that I mentioned earlier is the fact that we need to go into a meeting being prepared and try to be knowledgeable. So we really do have a responsibility, and I'm going to say the facilitators of the meeting have a responsibility as well, but often don't think about it. But we need to be able to learn about who the people in the programs are and what they do. So if you're invited to be part of a task force or a work group, ask for information about who are the other people on the committee, what are the programs we're going to be talking about, what do those programs do? Ask proactively for that information before the first meeting. Ask for an individual orientation if that would be helpful. Say, you know, could we meet and have a cup of coffee and you could tell me more about this committee and so I could better understand. That's a thing especially going to be important if you're being invited to join a meeting that has already started and has had previous meetings that you weren't part of. Again, I can't say it enough. Don't be afraid to say, I don't quite understand or I need clarification. Help to educate yourself about the issues that concern all of the people affected by this system. So ask other parents, you know, I get to be on this committee and it's focused on TEFRA, and I'd like to know what your experience is with TEFRA. Can you tell me more? Seek out other parents and ask them to give you information about what they've experienced so that it's not focused only on your own personal experience, but you want to be able to represent the needs of other patients and families. Being able to participate in family networking groups or conferences is going to help you with that. But you can also say to them, you know, the leaders of the committee, you know, do you have family satisfaction surveys that I could see? Is there some state or national data that you might be able to share with me about this topic? You can come to us and to Family Voices and say, you know, what do you know about this topic? Do you have any data you can share? Do you have information about what other families experience that you can share? That way you're using not only your personal experiences, but you're representing the needs of other families as well. Share the spotlight. Suggest to other families who could also participate in advisory committees or activities. this is something that it can really be very helpful. And it's especially helpful for families who may be typically underrepresented, such as immigrant families or families for whom English is a second language. And then see how you can provide encouragement and support to those families who might be added to a team or invited to be on a team. You maybe could do things like meet with them beforehand or after the meeting and talk about what went on at that meeting, and kind of share information with each other and help that person feel more comfortable at that meeting. So I think I've mentioned this before, but we should always assume the best about other people. Everybody has baggage and, you know, comes to a team or committee with baggage. Maybe shouldn't be that way with professionals, but it is. Look for ways that you can build bridges, respect the perspective of others, and make sure that you're keeping an open mind. I know I've already talked about a lot of that, but I think one of the things that we can do is to gain respect of our fellow committee members is to make sure that we're always following through on what we say we will do. If there are certain homework assignments or certain feedback assignments that are given, make sure that you follow through on them in a timely way. If there's some reason that you can't do it within the time frame, let them know. Let them know that you need more time. But take deadlines seriously when a team makes a deadline or requests feedback on a certain topic. But you know, if you can't, then you need to let them know that you can't, and you know, say, well, I don't know if I can get you feedback by Friday, but maybe I could by next Friday. I think I just said that. If you can't, let them know when you can do it. Make sure you're prepared before every meeting. Read all the material that's sent out, review the agenda, and again, do your own research on topics in the agenda. Again, ask for direction. If your team is vague, ask for specifics. Participate in the discussion actively and with confidence. Take the lead when you can. Use your expertise. And always keep in mind that your voice is necessary to make changes and improvements. So this is my last slide. I just want to make sure that I say that again. You know, colleagues come to a team with varying different experiences and expertise, and all that expertise and experience has equal value. And always remember that your voice is necessary for change. So I know I've covered kind of a lot of information in kind of a short period of time. Well, it's not really that short, but I've talked for a lot. And I'd be interested to know what your experience has been in this area and what some of your thoughts might be about how you can use these tools.
So it's open now for everyone. If you'd like to question, comment, or even share with Carolyn and the rest of the group, as she indicated, some of your own personal experience having served on teams, committees, or whatnot, and how you've utilized or would like to utilize some of these tools. Like I said earlier, if you don't want to unmute and speak and you'd like to just type it into the chat box, if you hover over along typically the bottom, you can see the chat. Until someone comes up with another question or comment, Carolyn, I will say I think that one of the things that stand out to me the most is that when I first started getting asked to be on committees and teams, it was like all of a sudden everybody was asking me, and I had to be very selective, or else I would have donated all of my time to being a volunteer on a committee. And so one thing that I learned was to really investigate and learn about what that particular committee was trying to do, how they were going to use me as a family advisor, whether they legitimately wanted to partner with me to you know, if they valued what I had to say, or if it was just kind of like well, we need a parent on this committee, so let's check that box by having Tricia sit here for 2 hours. Another way that I could gauge how much, and not always, because some places just don't have the resources, but sometimes you could gauge if a group was putting resources into having family advisors. And sometimes that's gauged by, do they offer childcare? Do they offer a stipend or reimbursement for travel? So those were some things that I learned to consider. Sarah St. Louis shared with us, I have found that those that have your child's best interest at the forefront are the ones that are most likely to listen to you and collaborate with you to help reach the best option or goal for your child. Mary agrees. And Carolyn, I think you talked about this when you talked about the common goal in your slides.
You know, it's interesting because it's not very often that especially when we're working with a group of providers with our children, not very often that we really sit down and talk about what our goals are. I mean, we do that in the education system, you know, sort of those educational goals, which aren't necessarily what our goals are. But if we think about in the healthcare system, it's not very often that we talk about that related to our children. And I think it's a really important conversation to have. You know, what are our goals for our children and for our family? And to be able to talk about it broader than just those health goals, but what are our family goals? You know, what do we envision for our family and for our child's future? Those are conversations we ought to be having with healthcare providers, as well as obviously the education system. But it's funny because we often don't.
Yeah, and I think that just one example would be too, you know, if you're asked to be on a committee and you ask what is the, you know, what's the purpose here? You know, if the purpose of the group is to reduce emergency room visits from patients ages 5 to 10, you know, are they really looking, if you need to look at how you can contribute to that, what your experience is, and make sure that your goals are aligned with the committee's purpose. Sarah said, I found that you really need to educate with a great amount of patience sometimes for those that are more interested in their goals or time, or simply inform them of the laws, rights of your child and the difference between you being that parent and an advocate for your child. That's a really good point, Sarah, and I think Carolyn provided us with a lot of tools and different approaches and ways that we can emulate advocacy for our child and really teach by our actions. I don't know, Carolyn, did you want to comment on that as well?
The one thing I think about is the fact that providers and both in the healthcare system and sometimes in the education system and certainly in the health and human service or the human services system, they're not very good at communicating. And it's not something that they learn, quite honestly. It's not part of their education to talk about really good communication. But we really have an important role as families to be able to model good communication. And when we're modeling that good communication, they're going to learn from us about how to do that. And that goes back to, I think, one of the things that I talked about really early in the slides is that we communicate clearly and directly, but in a kind way. I think there's nothing worse than beating around the bush, but it's really helpful to just be clear and direct.
It really is, and I think if each of us take a look at, I mean, everybody on this call and part of this cohort and our first cohort are strong family leaders. And my assumption is, and I think it's probably a very correct assumption, is that all of your children's or a lot of your children's providers look at you as a pretty savvy parent. They probably hold you in a higher regard, and just think of the power that holds to be able to influence and teach those providers by asking questions, because they might say, wow, you know, Jamie had a question about this. I just assumed she knew. Jamie knows so much. She's, you know, so on top of everything in this arena. Wow, I missed that. And I need to do a better job of covering that, not only with Jamie, but all of my patients' parents who might be wondering about this too.
This is Dawn. First of all, Carolyn, I want to thank you. This is part of, as a parent educator, how I've tried to live my life work and my professional work. It's always good to have reminders. You gave me some very good reminders again. And there are pieces that I really didn't think about in regards to making the partnership more with my son's medical team. And as I work with families, I love that idea of helping to show them that they can be the role model to that team and to their colleagues on that team or committee that they're working with. I've always gone with the premise of do no harm. That means to anybody on that team too. And so, again, I want to thank you for this presentation and the very timely reminders about what it is to work with families, for families, as well as for myself.
Oh, that's nice, Dawn. Thank you. I hope this has been helpful.
So are there any other questions or comments? Hearing silence here, I am going to talk a little bit about your assignment that we've come up. Oh, and of course my dog starts barking right then. I'm so sorry, folks. So sorry about that. The assignment today is not too tough, but your session 5 assignment is to sit down and recall your top 3 to 5 themes that emerged when you did your strengths assessment. What we'd like you to do is write down those top 3 to 5 and then do a little self-reflection on what skill or skills you'd like to further develop to become more confident in representing the family perspective on national committees, statewide committees, local committees, advisory councils or groups, anything like that. So really just think about what it is that you'd like to focus on enhancing. Then what we'd like you to do is just create a simple little plan on how you're going to leverage your strengths to help you develop those skills. You know, we always think of it this way: your skills plus your strengths are really going to guide you to leadership opportunities. They may not look the same for everyone, but it should be through this self-reflection and this assignment that you can start to maybe get a little bit of direction in what would be a comfortable fit for you. So to summarize that, what we'd like you to do is simply write either in an email or on paper and then scan it or email it. At the top, put your top 3 to 5 themes and just maybe a few sentences to a paragraph on what skills you'd like to develop to enhance your leadership skills. If you have any questions, you can email me, Tricia at familyvoicesmn.org. Y'all have my email address if you join this webinar today. And if you have any questions, I'm sure Carolyn would welcome any emails as well. If you think of something as you're doing your assignment or as you're processing all of this information, I believe Carolyn would be just fine with you emailing her. I can send this via email just to everyone what the expectations for the assignment are. And Jamie, thank you for reminding us, everybody's been paired with a peer mentor. If you have any questions or would like to talk about this, I encourage you to connect with your peer mentor from the first cohort. If you've forgotten or you don't remember who that is, that's just fine. Just email me, respond to the email, let me know you'd like to know who that is. You can talk to me anytime or your peer mentor. Watch for that email with the written description of the short assignment. If there are no other questions or comments today, and I don't see any, I just want to thank Carolyn so very much for taking the time to put this information together for us today. Some of this, I guess I already knew, but like Dawn said, it was a really great reminder of how to be successful in making these partnerships and really truly becoming an essential ally with your child's providers and individuals on councils and different advisory teams. Thank you all for your time today. I really appreciate that as well. And we look forward to talking with you again on our next, our next session 6, which is the history of disability here in Minnesota with Colleen Wick. That'll be April 8th at 12:30 p.m. And I must say that I've heard a very similar presentation from Colleen Wick in the past, and it's absolutely eye-opening and wonderful. So I hope you can all join us for that. I will also put that in the email. Thank you all again for your time today, and we wish you a wonderful and happy Wednesday.
Thanks, everybody.
Thanks again, Carolyn.
Thanks.